Welcome to the CNS Podcast featuring Dr. Daryl Inaba, Research Director for CNS Productions.
A week ago, our Genesis program here in Southern Oregon concluded its third annual conference. And the conference is about addiction medicine and about the developments in the science of addiction. We had an amazing conference this year with speakers coming all the way out from Florida. C.C. Knuckles, Caldwell Knuckles, came out to talk about neuroscience and spirituality and the 12-step interplay with that in recovery. Then we had from Chicago, Dr. Andrea Bartwell, who was the Deputy Director of Demand Reduction in the United States under the Bush administration, Drug Czar's office, and she came to talk about the neuroscience and neurobiology findings in addiction at this time. And then we had Chuck Jackson. Chuck Jackson came out to us from Oklahoma, and Chuck talked about compassion fatigue, about the need for people who provide services in this field to really monitor themselves and keep themselves healthy as well. So it was a real exciting conference. I gave a talk on prescription drug abuse, but like all conferences, I think one of the most valuable things I got out of it was sort of just hanging out with the speakers and talking about what they're into and what's happening. And at one of our dinners, it was Dr. Andrea Bartwell, who had just left the medical science meeting of the American Society of Addiction Medicine in Toronto just a week before our conference, who came and told me what was going on at that conference. And if I had a chance to go, I would have gone to that conference because it always has some fabulous developments in this field. And what was interesting, I think, to me, was that she said that at this ASAM conference, there was a lot of policy discussion. Many people were talking about policy and the need for professionals in this field to get involved with policy, to look at the Mental Health and Substance Abuse Parity Act, to look at the changes being done in the Senate and the House and how it might negatively affect that bill, and how we really need to push forward a bill that's going to be useful to those in need in this field. She also talked about the development of screening and brief interventions, and that's something I want to do here in Southern Oregon, is really come up with a mechanism where there's almost a universal screening. Every physician, everybody treating anybody does a very brief screen, only a minute or 2 minutes, about drugs and alcohol. And if there are issues, utilizing the instruments we have, like the CAGE instruments, then to do a brief intervention to get those people into treatment, because this is still our #1 public health problem, and yet the majority of people who need care, and even those who want care, aren't able to access it or get involved with treatment. So I like to see that happen, and it seems like on a national basis that's happening as well. The third item I think was most interesting from a scientific point of view, and that was the development of diversion-resistant medication. We are finally admitting in this country that besides the methamphetamine thing, the heroin, the cocaine, what we really have going on right now is a dramatic rise in prescription drug abuse. We have prescription drugs being diverted for abuse all over in every age group, and then they actually outnumber those abusing prescription drugs, outnumber those who are abusing methamphetamine, cocaine, other drugs. Only marijuana, I think, and nicotine, alcohol, of course, but only marijuana is being abused more than prescription drugs right now. In response to that, pharmaceutical firms are again trying to come up with medications they say nobody's going to abuse. They're talking about things like compressing a naltrexone, a narcotic antagonist, the oral narcotic antagonist naltrexone, and compressing it into such a hard ball that if taken orally, it will just pass through the GI system without being absorbed because it's too hardly packed. And spraying on top of that time-release morphine. So that prevents if somebody wants to crush that up, like they do crush up Oxycontin and they crush up other medications, they would be crushing up the naltrexone, and if they took it, that'll eliminate that effectiveness. It can't be tampered with. They're also talking about this sort of plastic matrix, the silly putty matrix that morphs through your GI system after you take it, so that only portions of drugs are exposed at certain times, and you can't crush it, you can't smash it. They say you can't wash it. They're talking about patches, like the fentanyl patch not being abusable. And as exciting that sounds, to me, I just cannot imagine that the street won't come up with a way of abusing anything they put out there. I'm convinced that no matter what they do, the street is smarter than all the scientists in the world. And I can just see now what they'll do with that compressed naltrexone tablet with the morphine sprayed upon it. Is they'll wash it. Take some lemon juice or something, wash the morphine off of it, and get access to it that way. They're going to take that plastic silly putty thing, and they're going to figure out a way, I think, to release the medication in there. The fentanyl patches and the other patches they've come up with, I've already have clients that I've talked to say, hey, you take one of them patches in the sauna or in the hot tub, and it just releases all the drug that's in there. So as much as, science tries to prevent drugs from being abused, as much as we try as a society, or at least our politicians continue to try and fight a war against drugs by doing the supply reduction and preventing drugs from getting in this country, I still believe that's a lost cause. I still believe that's not putting our best efforts into dealing with this problem. I think we would be served best if we start paying more attention to treating and preventing drug addiction. Those are areas, and that's the battlefield that we've been winning, and we continue to have successes in. And if we invest in that, I think we will finally start doing something with this problem.
That wraps our pod for today. Thanks for visiting the CNS Podcast. Please check back soon for the next in the series and visit our website, www.cnsproductions.com.